Hi, I'm Nick. I'm a second year neurosurgical trainee at Flinders Medical Centre in South Australia.
Hi Nick. So can you tell us what first sparked your interest in medicine?
It's actually a really interesting, well, I find it an interesting story. I was in year 10 in high school when we were just starting our biology kind of section for school, and we were studying anatomy, and one of the first things we did was dissecting cow hearts. And so we all broke up into groups, and we got to dissect through the valves and look at all of the anatomy of the heart. And yeah, it was very, very interesting. I found it really kind of opened my eyes as to how interesting these kind of things can be. And surgery then became a real passion that I wanted to pursue further. So then I was very focused on trying to get into medicine, and spent the next 2 years, or the rest of year 10, and then my final years in high school trying to get into medicine.
And so what made you decide to pursue neurosurgery as a career?
From that experience, I was very, very interested in cardiothoracic surgery when I first started, and then in my first year in med school, I went to university in James Cook up in Townsville, because I'm from Brisbane originally, and we had the opportunity to do a 2-week placement anywhere we wanted in healthcare. And so I went back home to Brisbane, and I went and did 2 weeks with a neurosurgical practice in Brisbane, and it was amazing. Like some of the stuff that they did was, I saw, the first operation I ever saw was the removal of a meningioma, so a benign tumor on the outer surface of the brain, and yeah, it was just amazing to see that done. And I also saw deep brain stimulation being done by one of the surgeons as well, which was, it was in an awake patient with a very nasty tremor, and you could see when they would put the electrode into the area of the brain that they wanted and turn it on, you could see their tremor go away. And yeah, it was very, for a first year medical student, it was a really inspiring thing to see. And then I spent the rest of my time in medical school learning more and more about neurosurgery and getting more and more passionate about it, and yeah, haven't stopped.
How many years does it take to train to become a neurosurgeon?
I think it depends how far you want to take it. I mean, if you include your last 2 years of high school, which nowadays is very important because it's very challenging to get into medical school because of how selective it ends up being. I did an undergraduate pathway, so I did high school, then straight into a medical degree, which was 6 years. And then you do a year of internship, and then you can do a few years of being a resident, depending on where you are. I just had to do one. Then you do more time as a service registrar or an unaccredited registrar, which is where you work in neurosurgery and you do on-call shifts. You work in the clinic, you look after the pre- and post-operative patients, and you're involved in the surgical management of them, but you're not being trained as a neurosurgeon. And most people spend anywhere from 3 to 5 years doing this as you build up your experience to get onto training. I was very fortunate. I only had to spend 2 years doing that. And then when you get into training, it's anywhere from 5 to 6, 7 years of training, plus extra time if you want to do research. So I'm hopefully will finish my training in 5 years and then do an extra year of research, which I'm going to do next year, and then either a year or two more of subspecialty training on top of that. So like 18 to 22 years, I guess, if you include high school, and depending on how much extra you do. So yeah. It's a long journey.
And so throughout your training so far, have you had any standout teachers or mentors?
I think everyone that I've worked with in some capacity at every level I've taken little pieces of wisdom from them, whether they meant it wisdom at the time or not. I think it's hard to bring up a specific example, but you can be in a clinical situation, or even just in a when you're trying to teach a junior or you're getting advice from someone else, you can remember. I don't know, it's hard to explain. Yeah.
I think I know what you mean. Have you trained, or are you hoping to do any training overseas?
Yeah, I had spent my last 3 months of medical school at Cambridge in the UK, at the neurosurgical unit there, which is really, it was an awesome experience. It's a huge unit. They have a referral base of 4.5 million people. which in Australia is just unfathomable. So it was a busy unit that ran 24/7, and I could just be assisting in theatre or helping out in research or being in clinics at any hour of the day. It was really good. I wanted to pursue a subspecialty in skull base, and so that does require more fellowship training once you finish your normal neurosurgical training. So at the moment, there are a few centres around the world that are really good opportunities to go to and learn more. North America is a place, so anywhere in the US or Canada. The UK is another place as well. So I think overseas training is something I'll have to do. I haven't really got my sights set on a specific location yet. It'll be whichever places I'm lucky enough to get an opportunity to go to.
Yep. And so here in Adelaide, where are you currently training and operating?
So I'm at Flinders Medical Centre at the moment. I've been fortunate so far to spend all of my time in South Australia. So I've been either at Flinders Medical Centre or at the Royal Adelaide in the neurosurgical units there. Flinders, when we're on call though, we do cover the Women's and Children's Hospital as well, which can get quite busy. So I've operated at the Women's and Children's a few times, but we don't work there full time, if that makes sense. We're employed here at Flinders.
Yep.
Yeah.
And can you give us an example of what sort of an average day in your life at the moment is like?
It won't sound particularly inspiring. I mean, being a neurosurgical trainee is very busy. I mean, it's busy in that your entire focus for 5 to 6 years is learning how to operate and how to be a good neurosurgeon and all the other stuff that comes with that. And as a result, your entire life kind of is focused on, well, at least for me, my entire life is focused on that. So I get up probably at like 4:30, 5 o'clock in the morning, try and get some study or some exercise in. Then ward rounds here start at 7 o'clock, so you get in maybe 15, 20 minutes early, check on all the patients, check that anything has happened overnight. Then ward round takes about an hour from 8 a.m. then till 6 p.m. we'll be in the operating theatre doing a variety of cases, and then we'll do a post-ward round check with the team, and then I'll sort out some other stuff that has been delayed throughout the day, like organising lists and things like that, which I'd leave here about 7:30, 8 o'clock, get back home, see my wife and eat dinner and go to bed. If you're on call, it's a bit more unpredictable. You can end up spending a lot of time here with the women and kids, and sometimes you don't get an opportunity to go home, but it's very variable.
What's the most hours you've ever worked in 1 week?
I don't know, a lot. Probably easily over 100. Yeah, I can't remember. I don't have a specific number on hand.
What's the longest you've ever gone without sleep?
I don't know a good answer to that either. I think you sometimes have to do a lot of call, and when you're on call, it can be very busy. You get a lot of phone calls, you get a lot of broken sleep. So every 30, 40 minutes you could be getting a phone call. So at Flinders, you're on call for all of South Adelaide all the way down to Mount Gambier, and then for the kids, for all paediatric neurosurgery, South Australia, the Northern Territory, rural Victoria, and even sometimes rural New South Wales. So yeah, you can get a lot of phone calls, and particularly with COVID now, with staff being off, you can end up having to do a lot of call. Like I've been on call, the last 7 days I've been on call for 6 of them. It's a 24-hour call period, so it's a lot of time you end up getting on call.
What was your first surgery on a real patient?
The first surgery I think I ever did was what's called an external ventricular drain. So it's blurs the line between surgery and procedure, but it's someone who has a buildup of brain spine fluid in their head. You put in a tube or basically like a small straw down through the brain substance into the water space to drain the pressure off.
What's the longest surgery you've ever performed?
Well, I think the longest that I've been involved with would probably be around at least 16 or 18 hours long. I'm still only in my second year of training, so I'm not performing those from start to finish on my own, but I'm involved with them and doing components of it. The longest I've probably performed on my own was probably about 6 hours.
And what's the most complex surgery you've ever performed?
That 18-hour surgery, that was very complex.
And what operation was that?
Removing a vestibular schwannoma, or an acoustic neuroma.
What's the most surgeries you've ever performed in one day?
It's not an impressive number. I think it would probably be like 3 or 4. Like, neurosurgery is different again because the surgeries typically are a lot longer, anywhere from 2 to 3 hours, 4 hours per procedure, per operation. So yeah, you end up doing longer operations but less of them.
And what is your most common surgery?
Probably the commonest surgeries that we would do would be evacuating what's called a chronic subdural hematoma, so an old collection of blood that forms over days to weeks that puts pressure on the brain. You operate on it by doing 2 small holes and washing away the fluid. That's very common, particularly in elderly patients. And then the other thing would probably be in people who have degenerative spinal disease, so the operations that come from that, like removing bulging discs or shaving off bone spurs to take pressure off nerves. Those are very common.
Coffee or tea?
Coffee.
Sweet or savoury?
Depends. Pastries, sweet. If it's something like waffles or pancakes, savoury.
Favourite sport and team?
I'm from Queensland, so NRL, and when I was in Brisbane it was the Broncos, and when I was in Townsville it was the Cowboys.
So can you tell us one of your fondest memories from your neurosurgical career so far?
Yeah, so I think the fondest memories I have are the patients that have had the best outcomes and cases that I've been involved with. There was one of the cases I remember was when I a few years ago was on call, and a patient came in after having a head injury, and they had a big bleed on their brain, and they were deteriorating very quickly from raised pressure in the brain, and were at risk of dying very quickly. So I took them to the operating theatre. It was the first trauma surgery that I'd done on my own, and it all went very well. The patient survived, and not only that, they ended up going back to work, which was nice. It was really nice to then see them in the clinic, maybe 6 months after the fact, and they walked in, told me that they're going back to work, and we're talking about when they can go back to driving and the difficulty they have with getting back to work and getting all the paperwork sorted out, which was, for severe head injuries, is just not a discussion you're normally having at 6 months. It was really nice to see the patient experience that.
That's fantastic, and thank you for sharing that with us. So you also have an interest in neurosurgical research. So what made you want to pursue that in addition to surgery?
Well, neurosurgery is a specialty that's really, modern neurosurgery as we know it today is very new. Really, it's since the discovery of the operating microscope and neuronavigation and microsurgeries, it's really only been around since like the 1980s. In the capacity that we know it as today, and there's so much room to improve and develop better techniques and better care for patients to manage some really serious and complex problems that still exist that we don't have good solutions to.
And how has the NRF supported you in your research? What would you say is the value of the Neurosurgical Research Fund now?
Well, I think I've applied for grant funding for the NRF, so I'm really hoping that they will support me with a generous grant. I think the value of the NRF, the difficulty with doing research in neurosurgery, particularly as a trainee, is that the ability to have financial support is very challenging. So at the moment, to do real research, you need to take time off and commit to it fully, and which is what I'm planning to do next year. I'm interrupting training and spending the whole year focusing on research. But the problem with doing that is that you have no employment. Then I'm no longer employed by the hospital. I'm not taking any income, and yeah, it's hard to. You then need to find a solution to that problem. Either you have you either save up the money so you can take 12 months off, but then you've also got to pay for the research as well, because no one will pay for you to do your research. And so I think having a grant to, and firstly enable you to fund your research so you can do proper research that makes a difference is helpful, but then also allowing you to pay bills like everyone else. keep the lights on, so to speak, is a good thing.
So what are some of the things that you enjoy most about neurosurgery?
I think that is a really good question. I think the things I enjoy about neurosurgery are the things that make it challenging. It's a specialty where a lot of the problems are very serious, and you can make a significant impact to patient lives. It doesn't really matter where it is, if it's in the spine or in the brain or the peripheral nerves. It can be they can present to you with a problem where they're extremely unwell. It can be a life-threatening tumor or anything, and you do an operation and you can save their life. Like, I guess that's not really something that's unique to neurosurgery. A lot of other specialties have that too, but I think it's the acuity of it, I think, is another thing that I like. It's, you really have to act quickly, and it's not something which some people probably don't enjoy, because it means that even when you've been a surgeon for 20 years, you still have patients where you have to come in the middle of the night, because that's what you have to do to get the best outcome for them, which is different to other areas in medicine, I think. And I think where the problems are, the anatomy of the skull and the brain, and it's not like anything else.
And what would you say are some of the biggest challenges?
I think it's the time commitment. You really have to commit 100%, I think, to do neurosurgery, or at least my experience up until this point has been that. And I think you have to accept that you will, compared to either your other peers who take a different path in medicine, or friends that people that you know and friends that you've had that don't go down this type of career path, you end up, you do diverge, you experience different things, and that's fine if you accept that. And I'm very happy with the decisions that have led me to this point, and I'm very comfortable with that. But I think some people may find it challenging, like things like marriage and children, or other hobbies that you want to pursue. It's there's only 24 hours in a day, and you kind of you're forced to prioritize what's most important.
And is that some of the advice that you would give someone if they're interested in pursuing?
Yeah, it would. And I think the other thing is start early. Like it's hard, I guess. In medical school, you're exposed to so many amazing specialties, and it's very hard that early on. I think I can appreciate it's very hard that early on to commit to something when you don't have all the information. But I think the earlier you can start, the better, and because it's a long road, and the more you can streamline things, the better. And probably the other thing is that if you spend a lot of time learning about a particular specialty and you realize it's not for you, then it's better to have discovered it earlier than later.
So August is Neurosurgery Awareness Month. So are there any aspects of neurosurgery that you wish there was more awareness around?
Look, I think that's a good question. I think one of the problems that we see in neurosurgery that you can build more awareness around and you can avoid is head injuries. I think the most important thing with head injury really is primary prevention. Everything we do in neurosurgery and when you come to hospital is to deal with the complications that happen after you've had the head injury. So the most important things are just trying to avoid it in the first place, like wearing a bike helmet, being sensible, using common sense. Don't climbing up on a ladder if you're, unsteady, or I'm constantly in disagreement with my family for them, my elderly parents that climb up on ladders, and the risk of them falling over.
Thank you. What do you enjoy doing in your spare time, and what are you passionate about outside of work?
So the spare time, when I do get spare time, I really enjoyed skiing and diving back when you could travel more easily, pre-COVID. So hopefully in the coming years, as things open up and become more easy to access, I can get back into doing that. But I also enjoy cooking at home with my wife, cooking up, like trying new food, new recipes, going to new restaurants as well, which again has been a challenge from COVID, but thankfully at least the last, this year has been a bit easier to get out and about and enjoy those things.
Do you have a favourite spot that you ever went to dive or ski?
I, probably 3 or 4 years, just before COVID hit, I went skiing in Niseko, like off-piste skiing in Niseko, which was amazing. Really want to go back as soon as I can. Diving, I think probably the best place I've been diving would have been, I did a wreck dive off the Sunshine Coast, which was really nice.
Yeah.
That was an interesting experience. Up until then, I'd only been reef diving, which was also fantastic. But yeah, it was just a new challenge.
So can you explain what is wreck diving?
So it was I think it's the HMAS Brisbane. It was sunk off the Sunshine Coast in Queensland to create an artificial reef, but you can go diving through the ship.
Oh, that sounds cool.
Yeah, which is really cool.
Yeah. And favourite restaurant? Do you have a particular type of cuisine that you prefer?
No, I love, my wife and I really like to go to Italian places. We also like Japanese. We like, just trying all new things.
Yeah, we have so many great options.
Yeah, Adelaide's really, because I grew up in Brisbane and then med schooling in Townsville for 6 years. Adelaide is unique in that it's got so much great food and wine available. It's a really good place to live.
Yeah. And do you have a quirky or interesting fact about the brain, spine, or neurosurgery in general?
So I've been fielding opinions from friends and my wife as to what's a good fact that I find interesting and what everyone else will find interesting. I think what we settled on was probably something like that a 2-year-old's brain, because kids will, infants have very large heads. A 2-year-old has, their brain is 80% normal size compared to an adult, which is, interesting, I guess.
I agree. I have a 3-year-old. I find it interesting.
Yeah.
All right. Well, thank you so much for taking the time to interview with us today. We really appreciate it.
Thanks.